Hello and welcome to EyeMedics Podcast, where we bring you trusted insights and latest treatments in eye health. I'm your host Bindu, and today we're going to talk about one of the most common eye conditions worldwide. Yes, I'm talking about cataract. We're going to talk about what is cataract, who is at risk to get it, what are the symptoms, how can we treat it. To answer this and more, I have with me Miss Shakti Thakur, lead ophthalmologist and medical retina specialist at EyeMedics. Welcome, Ms. Thakur.
Good morning. Thank you so much.
We're going to start with the very basics as always. What exactly is cataract?
So we all have a natural lens in the eye that does the focusing. So just focusing for distance and for near. And that lens is clear when we are born. And then gradually as we age, in many people, it becomes opaque. So it's like looking through a cloudy window with patches that have gone a bit brown, rather than looking through a clear window. That essentially is a cataract.
Who is more likely to develop cataract?
By and large, it is an aging process. So most of us will develop cataract by the time we are in our 80s. Having said that, there are some who get to their 80s and 90s and have very little cataract. So certainly lifestyle has something to do with it. But if you have been using steroid drops or steroid medication, or if you're diabetic, or if the eye have suffered any trauma, whether that's any kind of injury to the eye directly, any inflammation in the eye, anything like that will cause the lens changes to appear much earlier. And that's because you have changes in the biochemistry so that you're developing those patches of clouding at an earlier stage.
So that's more likely reason why a lot of people in their 50s and 60s have cataract as well.
That's right.
Okay. My next question is that what are the early signs to look out for cataract?
So most people will notice a bit of misting. Obviously, it depends on the lighting. If there's just a general opacity throughout the lens or just a little bit of lens opacity in the center, often those symptoms are more noticeable in very bright sunlight and decrease the quality of vision when you're out and about. Other people will notice it when they're driving and particularly have problems with glare. People can get double vision, and that double vision is still present if you cover up one eye. So there's a difference between having double vision, which persists if you cover one eye, and if there is double vision, and when you cover one eye, the double vision disappears. It's what we call monocular diplopia. So the vision is still double when you cover one eye. That's usually an underlying cataract or something else that is causing an opacity in the light coming from outside the eye in going all the way to the back of the retina. The third problem is usually just difficulty with everyday tasks. If you're struggling to read or function or failing to meet the driving requirement, that's quite a common one.
Okay, so that's helpful. And I'm sure our listeners are also going to be greatly helped by what you just shared with us. My next question is that how can someone be sure that they have cataract? Of course, they need to go to see their ophthalmologist.
Yes. Yeah, you see, there are so many things that can cause difficulties with the vision. The signs can be due to problems with the retina. It doesn't just have to be a lens opacity. Any opacity from the front of the eye to the back of the eye can cause similar symptoms. So you do need a thorough examination to make sure it is the lens that is the cause of the problem and not something in front of the lens, so something on the surface, on the cornea, or something in the retina, a macular problem, for example.
Many people, when they hear the word surgery, like you need a cataract surgery, they tend to worry. I'm going to ask a very layman question. Is there any other option to treat cataract other than the cataract surgery as it's known?
For the most part, it is just cataract surgery, which is nothing to fear, really. It is now done through a very tiny incision. And for most patients, it is a very quick and easy process. Obviously, surgery has its risks, but those risks can be minimized. And each patient has to be advised about the risk-benefit ratio in their particular situation. So I think it's really important that patients are involved in the conversation and the decision-making, so that if a patient has a cataract, but it's not actually having much of an impact on their day-to-day life, there is no need to proceed with cataract surgery. It only needs to be dealt with if it is significantly impairing lifestyle. And that will vary a lot from patient to patient. Now, coming back to your question about is there anything else that can be done? We don't have any other treatment in modern medicine. Of course, there will be things out there on YouTube, etc., that claim that there are certain eye drops that may help. It's difficult to know because we don't have any studies that would show benefit in terms of
that it can treat cataract.
But probably there is something to do with anything that has antioxidants may help in slowing down the biochemistry, the biochemical changes within the proteins that are causing the proteins to go from transparency to becoming opaque. So healthy lifestyle, those kind of measures are probably important.
That's my next question to you. Is there anything else that patients can possibly do to either delay cataract or make sure they don't get cataract?
Avoiding factors that we know can hasten cataract, can speed up the cataract. If you're on steroids, well, there's probably a reason that you're on them, but some people may be on them unnecessarily or for long periods, and see whether there are alternatives. Diabetes control, that's really important because poor glucose control will certainly make cataracts develop more quickly. Vitamins, generally as part of a healthy diet, a healthy lifestyle with exercise, maintaining good body weight, all of those things probably matter because good blood flow and good nutrition will probably help. But we have no absolute proof of that.
Right. So all in all, a healthy lifestyle.
Correct.
Delay. So before we sign off, as usual, we'll do our quick myth-busting round. Are you ready for it?
Of course.
My first question is, cataracts only happen in old age?
No, I think we've already addressed that. They can happen. Some people can even be born with cataract. It can be a congenital cataract. So it can happen at any time, but the majority are certainly in the older age group.
Okay, great. Cataracts can spread from one eye to the other?
It's not an infection that spreads. But if you have one in one eye from an aging process, both eyes are aging roughly the same. So you're likely to have the same in both.
Cataract surgery is risky and painful?
Not for the majority of patients. However, the risk does have to be evaluated by the surgeon very carefully per patient and per eye. The risk may be different from one eye to another, depending on the anatomy.
Does that also mean that you should wait until a cataract is, as they say, ripe before you go in for surgery?
No, that's no longer considered useful. There has to be an optimum time. So neither too early where you wouldn't actually notice the benefits, nor too late when actually waiting for the cataract to become very dense makes the surgery a lot more difficult and the risks of complications go up significantly. So there's a sort of window where it's neither too early nor too late, where it's minimal risk for the patient and for the surgeon.
Using mobile phones or computers causes cataract?
I don't think we can say that at all.
There is no research right now to tell us that, is there? Okay, great. So my last one, cataract can come back after surgery?
No, but you can get a bit of misting behind the lens implant because you have a little plastic lens implant that's inserted. So often we get a little bit of misting that grows behind the cataract. It's actually a smudge that gradually creeps behind the lens, but that's very easily treatable with a single outpatient laser procedure.
Okay, great to hear that.
So cataract surgery is the most frequently performed surgery within ophthalmology and probably one of the most frequent performed procedures worldwide. So there's enormous amount of experience in capable hands when you've got the timing right. There is really nothing to fear. It's a procedure that can be done quickly and safely as an outpatient procedure. So you're in and out. Generally, the procedure takes Around half an hour, maybe even less, 10 to 15 minutes. So nothing to fear. When you need your cataract doing, go and have it done.
Thank you so much, Miss Shakti, for breaking it down so clearly for our audience. If you are someone who's getting a glare, finding it difficult to drive at night, or feel like your vision is getting clouded, book an appointment at EyeMedics and come see the consultant to understand more. Thank you, Miss Shakti, once again.
Thank you so much, Bindu.
Till next time, take care of your vision because it's worth protecting.